Hi guys, today we're doing another interview with one of our advisors for the Universal Health Information Network. I'm excited today to talk with Dr. Jonathan Guenoun.
So my name is, again, Jonathan Guenoun. I grew up in Long Island in New York. I've been in New York for a while, and I've been fortunate to be in the healthcare industry sort of my whole life, growing up around it. My family has been in both pharmaceutical and also long-term care businesses, so I've sort of seen both ends. And I'm currently an anesthesiologist at NYU Langone.
Sure. Tell us a bit about some of the challenges you may have faced in the healthcare industry.
I think for me, one of the biggest elements is being able to navigate the system to ensure that we are providing the best care for patients. I think that sometimes it's lost and the focus is lost on the patients, who really should be sort of the primary driver of what's going on. And the part of it is structurally, part of it is just in order to provide viable services, you have to be operating in green. But I think sometimes the focus is lost.
So you talked about focus on patients.
Yeah.
So one of the things we're finding in all the work we're doing is, even though it seems simple, the general public isn't necessarily familiar with patient-centric care. So could you talk from your perspective about what is patient-centric care?
Yeah, sure. I mean, I think that I think it's also very important to basically prioritize in the sense that just as humans are very complicated individually, can you imagine the healthcare system as a whole in terms of a combination of the humans and their entire existence is unbelievably complicated. And I think what has lost track is that the patients themselves are sort of feel plugged into a system and not necessarily feel the personalized care that they sort of require or need. And I think that's where patient-centric focus comes in, where normally, you know, even modern times where it's been patient-centered, where the physicians have been partners with patients, but patient-centric is really where the patient themselves are the driver of their own care.
Sure.
In their ability to basically obtain information, to participate in their decisions, to make their decisions with only sort of ancillary help from either the health system or physicians, providers, nurses, but they themselves are the ones who guide their own care.
Right. So one of the things which I feel, researching this across the world, is that one of the impediments to implementing true patient-centric care is that patients don't have access or control over the health data. Do you agree with that?
Yeah, I think that's one important element to the whole, to one of the many variables that go into it. But yeah, of course. I mean, I think that because patients are sort of fragmented in terms of their information, where their information is stored, even how it's stored. Obviously, if it's not a structured data set, it's variable from physician to physician, from center to center. So sometimes you lose the thread of either the illness or a thread of the prescription or a thread of any sort of element to the actually care the patients receive. And I think EHR is an element that is an impediment in ways, but it also is a necessary evil.
Sure, it's required.
Right, it's required.
We can't do without electronic systems.
Exactly, and data is only valuable if you know how to use it. Meaning anybody could have a ton of information, but if you don't know how to be able to extract it,
but if a patient has to, go to a hospital and worry about getting the data from there, as opposed to just having it with them and then interoperability carrying it, I think that's one of the problems with electronic.
Yeah, I think that's one of the major issues, and I think that patient participation and patient frustration, a lot of that stems from their requirement to repeat. And just as anyone else forgets information, patients themselves forget information, especially patients who have a complex, the ones that should be focused on with complex health issues sometimes obviously leave things out.
So let's talk more about electronic health records. There's a number of credible studies which say that electronic health records are actually the highest factor responsible for physician burnout. Do you agree with that? And could you share some of your thoughts on that? Why is that the case?
Sure. I mean, I think it depends on the physician group. I think the utilization of the health record is definitely, like sort of you hinted to, that it's a necessary evil. I think the frustration is not using a health record. I think every physician knows that we have to use a record, and it's important to be able to sort of quantify the information, to be able to refer to that information at a later date. It's more of the fact of how sort of unusable that EHR is, that if it was more embedded in the workflow and it was more user-friendly, I mean, it would make a huge difference. I think part of their frustration is the fact that it isn't efficient. You know, I think everyone agrees, obviously, we need it, but physicians are pretty focused, detail-oriented, you know, motivated individuals that if it basically strive for efficiency. I mean, that's just important for patients, for everyone, and part of the frustration comes from that, I think.
So I think part of what you're saying is that they want the EHRs to be more user-friendly and fit their medical process better.
Right, exactly. I mean, I think that's a big element to where that burnout is. And I think, you know, obviously it depends on the health system, it depends on the local government, it depends on a lot of things that are input variables into what's mandatory in an EHR. But I think every physician agrees that, you know, this is the way we interact with patients. And we either can get on board and utilize it in a good way or just be marred in the mud in a bad way. So
And another challenge that I've heard a lot about is multiple EHR platforms. So without naming any specific hospitals or naming any names, could you talk a bit about, have you had experience where you've seen multiple EHRs perhaps in a single hospital, and have there been any challenges?
I think there's multiple EHRs, and there may be one formal software, but there's definitely engagement with other ancillary softwares that are necessary for imaging, for laboratories. And obviously it's frustrating, and obviously things get lost in the shuffle. I mean, the more times you have to transfer information, the more things are lost. I mean, it's no different than playing telephone. You know, the more times that information is handed off, the more times there's availability for error.
And have you seen this information transferred automatically in most places, or is it still manual sometimes?
I mean, for me, the end user, sometimes I can't tell.
Okay.
But I think there is some, obviously, automation to it. I think it's a mixture of both. Sometimes it's just a digital scan. You know, where you have to look at an old record through a paper. So that's obviously manually someone inputted. So I think it's a mixture of both. And obviously, HRs are sort of changing to become more seamless. But nonetheless, I mean, it's time consuming. Even switching can take 30 seconds, but 30 seconds may not feel like a lot. But when a patient's crashing and you need an image, 30 seconds could be a pretty long time.
It can be a life-saving situation, I imagine.
Exactly.
So we've talked about the Universal Health Information Network with you as well. I wanted to get some thoughts on that. What do you think about the concept?
Yeah, I think it's great. I mean, I think sort of to reiterate, the fact that patients are in the driver's seat is a huge deal. I think that that'll enable physicians to be able to provide better care. I think it'll make the patients feel more in the driver's seat and a partner in their own care. I think it'll motivate to them to even be plugged into the healthcare system in general. I think one of the values in this network is the sort of interplay and the unified platform, like you said. Being able to have all the information on one system can only be beneficial. I mean, I don't see any negatives to it. And I think the relationship can only be enhanced between, like I said, physicians and hospitals and multiple hospitals. I mean, patients, people travel, people do things, people move from locations. I mean, to be able to seamlessly transfer that information is somewhat invaluable, especially taking care of a loved one. You know, it's how many times do people travel to go to a cancer center? And if you have to start over with that information, you know, it's inevitably there will be gaps. But if you're able to just seamlessly transfer that, I don't see how that doesn't provide the best care possible.
So from your perspective, what are some of the things you'd like to see in projects such as the UNHN? Whether it be success criteria or things which are important to you as a physician?
Yeah, I mean, I think as an important physician, a lot of times the EHR is meant to click checkboxes in terms of mandatory legal issues that sort of basically billing, funding, and they don't necessarily interact with the end user, which is a physician myself or a nurse or anybody, a lab technician, a radiologist. All these are end users and they all have distinctly different roles. And they use the system very differently, and a lot of the times they didn't necessarily not consult, but necessarily keep that in mind, where it's sort of putting a square peg into a circle hole. You know, that's sort of how it feels sometimes. So I think that one of the more important things I like to see is sort of the fragmentation of the end user, and the fact that the end user, whoever is using the system to deliver patient care, is the one who's designing it and sort of optimized for
So friendly for end users.
Yeah.
And basically to us that means patients and physicians mainly. It should be
Right,
user friendly
exactly.
to them. Right.
Yeah, it's user friendly, and to be able to focus on, to be able to perform the best job, actually.
Sure, sounds good. Well, one of the things we definitely want to do is, as we are developing the UNHIN and implementing it, is to talk with physicians such as yourselves and get your perspective, because I think that's what's going to make it real successful. That's the most important thing for us.
Yeah.
So thanks for spending time with us.
Thank you so much. Thanks for having me.